Hello students, welcome to All About Nursing channel. So today's video is going to about medicine that is called methylprednisolone. So before knowing the drug, we have to know the group of this drug. So it is a corticosteroid drug. Okay. So the mode of action in this of this methylprednisolone. So methylprednisolone basically it is a corticosteroid and it is basically used in case of inflammation. So to reduce the inflammation. Okay. So any corticosteroid, their main mode of action is to reduce the any kind of inflammation. Okay, so methylprednisolone, by giving this, it basically acts on the glucocorticoid receptor site. So when we give the methylprednisolone, when you take the methylprednisolone, it binds with the glucocorticoid receptor site, and it transactivation of the anti-inflammatory genes, and that causes reduced production of inflammatory mediators. So inflammatory mediators like interleukin 1, 8, so there are tumor necrosis factor. So there are different factors are there, oxygen free radicals. So those are responsible, neutrophils are responsible for inflammation or inflammatory reaction. So by this medication, it binds with the glucocorticoid receptor site, and it transactivation of the anti-inflammatory genes, and that leads to reduce the production of inflammatory mediators. The mediators that basically trigger or stimulate the inflammation. Okay, so that inflammatory mediators became, the production became reduced. From there, the inflammation became reduced. Okay. Next, coming to the uses of methylprednisolone. So, as I said previously, the main indication is inflammation. So, any kind of inflammation in the body, like basically in the respiratory system, and basically in our laryngitis, pharyngitis, or any kind of respiratory infection, upper respiratory tract infection. So in that case, we can use this medication, or any allergic reaction, hypersensitivity reaction that triggers the inflammatory reactions. So in that case also, we can use this medicine to combat with the allergic reaction. So in the allergic reaction, what happens, there is activation of the inflammatory reactions, and that causes bronchospasm, inflammation. So by giving this medication, we can reduce the inflammation. Okay, and as well as we can combat with the hypersensitivity reaction, the allergic reaction. Next, in case of any different autoimmune disease, so in that case, we can also use the methylprednisolone to reduce or to suppress the immune system. So by combating or by decreasing the inflammation, it basically suppressing our immune system. So in case of autoimmune disease, what happens, our own immune system reacts or damages our own body cells. So in autoimmune disease, by this medication, by this methylprednisolone, we can suppress our immune system. Okay, so that the autoimmune diseases that our own body, own immune system damages our own body. Okay, so that can be prevented by suppressing our immune system. And different skin allergies, skin conditions, or inflammation, so in that case, we can use the side effect. So weight gain, there can be chances of weight gain. The patient can be, there can be a chances of hyperglycemia due to the corticosteroid like methylprednisolone uses. Insomnia, there can be chances of infection because of suppressing of the immune system, that causes, there can be chances of development of infection because of our immune system being suppressed. So that can lead to infection, insomnia, high blood sugar means hyperglycemia, weight gain. Okay, and the patient may be addicted to these corticosteroids. So corticosteroids should be tapered off, slowly tapered off should be done by, in case of any corticosteroid medication. If a patient is receiving corticosteroids, so we have to slowly taper off the dose. Okay, then the doses. So in oral dose for adult tablet form, 4 to 48 mg maximum we can give in divided doses, and for severe condition, higher doses may be needed up to 125 mg per day. But in children, usually 0.5 to 1.7 mg per kg per day in divided doses can be given. Intravenous IV, intramuscular IM for 10 to 40 mg every 6 to 12 hourly. So all the doses or the medication, it is not a OTC product, over the counter product. It is not that product. We have to take it by a physician advice. Okay, without physician advice, we can't take any medicine.